The United Nations Office on Drug and Crime commemorates the International Day Against Drug Abuse and Illicit Trafficking, marked on the 26th of June to strengthen action and cooperation in achieving the goal of a world free of drug abuse. The day, also known as World Drug Day, is an opportunity to raise awareness about the dangers of drug abuse, abstinence, prevention, treatment, and care. It is also a chance to challenge the stigma and discrimination that often surrounds drug addiction and abuse. 2023 celebration themed People First, Stop Stigma and Discrimination, Strengthen Prevention has been chosen to support, raise awareness, and combat stigma and discrimination. The media has been called upon to change the narrative of how drug abusers are perceived in the society and how it is reported.
This year's theme is People First, Stop Stigma, Stop Discrimination, Strengthen Prevention. When we look at the roles that we play, it's more in media advocacy, in a lot of prevention efforts that we have across the country. And this platform is so important because this year, a lot of the stigma is controlled by the media, because the media helps to define the mind of the people. They can amplify an information or reduce the value of an information. And it's important that the media that organizations like ourselves begin to talk to the media on how they can change the way that drug users are portrayed in the society, especially because most drug users find out that later they need help.
Femi Babafemi states that according to a 2018 drug abuse survey conducted by UNODC, the figure of those who abuse illicit substances in Nigeria stood at 14.3 million, which represents 14.4% prevalence rate. This implies a 5.6% global prevalence rate of drug abuse, putting Nigeria at almost 3 times the global prevalence rate, which is alarming.
Drug use is prevalent among the youth population. Initially, if you look at the survey, the drug use survey of 2018 that I mentioned, actually the survey captured those within the age bracket 25 to 39. But as you can see, and let me also tell you that survey actually covered those within the age bracket of 15 and 64, meaning that even those who were under 15 were not actually captured. Those who were above 64 were also not captured. But as you can see from our operations on the field and everything, on the field, our operations and our interdiction operation activities out there, we have seen that indeed those who are below 15 are actually already abusing these illicit substances. Those in primary schools, they're already exposed.
He added that apart from cannabis, which has many variants, likewise codeine, tramadol, swinol, heroin, cocaine, which are commonly abused, people that engage in drug abuse have been creative in manufacturing psychoactive drugs locally.
Apart from these drugs these known drugs being abused, you also have another threat of the drugs you call new psychoactive substances. That is the new mixtures by our people under the names Kushies, Molly, and the other one they produce with black currant and all manner of other illicit drugs, all manner of mixtures produced. They have different names in various communities across the country.
It has been noted that victims of drug abuse pay little or no concern about the health challenges that rise with it, despite the prescriptions and warnings set on these drugs.
Drug abuse, like is the use of psychoactive substance. Like I said, even if they have the uncontrollable effect, you still have the urge of using it. So that's where the abuse comes into play and can lead to addiction, whereby you can't stop it. Without it, you cannot function normally. Now, medically, when you take a drug, before you get to that level of abuse, it means it can be toxic to your system. So if you take a drug now, that most of these drugs that are psychoactive, they act on the brain, they can affect other organs. So it can affect the lungs, they can lead to lungs infection, they can affect the kidney, they can affect even other vital organs of the body. So in as much as it's giving you that effect that you want, making you high, is detrimental to other vital organs of the body, so it can affect your life expectancy.
Furthermore, a drug prevention counselor explains the gender disparity, stating that women are the major victims of discrimination in drug abuse, especially when they seek help.
When it comes to the person getting help, that's why they're saying stop stigma, stop discrimination. The person wants to reach out, especially in Nigeria. When you look at the ratio of women getting treatment for drug usage, for drug use disorder, it's so low. The statistics show that for the last statistics from the last drug survey, it showed that for every 7 Nigerians, 1 has used drugs in the last 1 year. For every 4 Nigerians, three using are men and 1 is a woman. And women go faster from casual drug usage to problematic drug usage. But in terms of treatment, from the Nuendo study that was done in Nigeria, among the 70-something treatment centers in Nigeria, you find out that for every 20 persons that is treated, only 1 is a woman.
To aid supply and drug demand reduction, NDLEA, which is a representative of the government, has set up committees like WADA, involving all stakeholders and necessary agencies, and CSOs to ensure drug abuse eradication.
So there can be quite a lot of programs and initiatives geared towards drug supply reduction and also drug demand reduction in Nigeria, especially in the last 2.5 years. And I can tell you that within that period, within these 2.5 years, we've had over 31,000 arrests made in order to cut down on drug supply reduction, that is arrest of offenders. We've had more than 5,000 offenders convicted, prosecuted and convicted, with over 6.3 million kilograms of assorted illicit drugs also mopped up from across the country. I mean, whether on the streets or in the forest, all of these have been done to cut down supply and availability of these illicit substances.
To stop stigma and discrimination and strengthen prevention, the intervention value change, which involves advocacy, sensitization, rehabilitation, and harm reduction, has to be engaged for victims to understand that help can be gotten.
In line with that, we had actually in the years past, and especially in the last 2.5 years, tried to strengthen our advocacy to ensure that those who are abusing these illicit substances get help rather than being discriminated against. And that's one of the reasons why the agency went ahead last year to set up a drug abuse call center, which has a toll-free helpline where people can sit in the comfort of their homes, especially those that are afraid of being stigmatized if they walk into a rehab center to get help. So we have this call center where they can call toll-free helpline 0800 1020 3040. That's the toll-free helpline. There we have our mental health experts, medical doctors, psychologists, psychotherapists, and the counselors ready to run with them on the phone, teletherapy. And for those in the assessment, for those who need to be checked into a rehab center, they also guide them through a directory of rehab centers across the country to locate which one is closest to them so that they can help them and guide them through rehabilitation in some of those places. So all of this we have done in the area of drug demand reduction, that is providing treatment and also ensuring that those that are treated, that have gone through treatment, are also properly reintegrated back to the society.
Glad to have you back on this segment of Engendered, and if you're just joining us, you're right on time, and the show is just about to begin. And today we'll be having a very important discussion. Today in the studio, we'll be talking about drug abuse and how it affects the female gender. And we're going to be doing that today with Mr. Kenneth Anetor. He is a drug prevention counselor and the executive director of a New Thing Foundation. You're welcome to the show.
Welcome to the program. You look like a
groom.
Well, actually, this is for the culture.
Okay.
Let people know that we have roots. We didn't just fall out of the sky. I must say that it's a pleasure to be here, and I'm grateful for the opportunity. Whenever the media takes cognizance of the work we do and give us a platform, we don't take it for granted. Thank you.
You're welcome, sir.
What culture is this?
This is the Bini culture.
It fits you so well.
Thank you so much.
Okay, you're welcome to the show. And we're going to be discussing substance abuse. This is ahead of World Drug Day, which is June 26th. And let me just read something before we start. It says here that the United Nations Office on Drug and Crime, UNODC team, for the 2023 International Day Against Drug Abuse and Illicit Trafficking is People First, Stop Stigma and Discrimination, Strengthen Prevention. This year, UNODC will raise awareness about the importance of treating people who use drugs with respect and empathy, providing evidence-based voluntary services for all, offering alternatives to punishment, prioritizing prevention, and leading with compassion. And we are choosing this particular topic because we know that it also affects the female gender. It is not something that is only peculiar to the male gender. And working with a team that says that we should stop discrimination and embrace prevention. I remember talking with you sometime and you mentioned the fact that women are not likely to get help because of the discrimination against them rather than compared to the men. Can you give us throw more light on that?
Okay, thank you again for the opportunity. This year's theme is Stop People First, Stop Stigma and Discrimination, Strengthen Prevention. When we look at the statistics from the drug study in Nigeria, it shows that for every 7 people in Nigeria, 1 has used drugs in the last 1 year. And this is a study done in 2018. And it shows that 1 person has used drugs in the last 1 year. Then for every 4 people using drugs, that 1 is a woman. And studies show that women go faster from casual drug usage to problematic drug usage, especially when they inject drugs, which means that a lot of women go from just experimenting to now being people with substance use disorder. But when they did a innuendo study in treatment centers, they found out that for every 20 persons that are treated, only 1 is a woman. So that now makes us to reason why women are not getting as much treatment as men, and that reason is stigma. Women face double stigma. They face stigma from healthcare workers in terms of they're trying to access the treatment and they're like, why are you here? You're a woman. Why are you doing this with your life? And that stigma is a barrier to their getting treated. They also face stigma from their fellow drug users. Fellow drug users stigmatize them, discriminate, tell them you're a woman, you want to be a man, you are doing this, doing this. Sometimes they also face stigma from their family members. That's to even access the treatment. But we will not even look at it. After they have accessed treatment, they have been treated, there was an opportunity that the UNODC did a program that empowered some civil society to do community-based intervention treatment in different communities, like drop-in centers. And in that period, they had some that were dedicated to only women, and they set a target of which women to meet their substance use disorder treatment needs. Their needs are unique, so to meet it there have to be specialized services, and those centers were empowered, equipped to give those specialized services. And those, because there was no discrimination, the workers that had been trained and sensitized, they were able to meet those targets and even surpass that target. It was one of the discussion that I was opportunity to be at the Governor's Wives Forum. The UNODC gave a presentation, and those were part of the presentation, the meeting. So even when these women have been treated, sometimes them being social reintegration back into the communities, going back into the communities, sometimes they will still face the stigma. This is someone that has been treated. was the person was a drug user, the person had substance use disorder, and the person has been treated, the person is rehabilitated and is going back, the person is still facing this stigma. And this stigma is being powered by misconceptions in people's minds. That's why I'm very grateful for this opportunity, because I feel like this year's theme is hinged on the media, because the media is responsible for informing the mindset of the people. And to break stigma, to break mindsets that have been built up in people's mind, the media has a large role to play. That's why I'm hoping that days after this World Drug Day, where the excitement, the euphoria is that we're celebrating on this day, that this interview can be played over and over again to change the mindset, because stigma is a huge barrier to people being treated and getting the help they need, and even coming out to admit that they need help. Before, there was a study that they did, and in the study they showed that there are a lot of people that felt that they use drugs, they don't care, they don't need help. There are a lot of people that felt that they need help and they don't know where to get help. There are a lot of people that felt that they need help, but because of stigma and they're scared, they won't try to get the help.
Okay, and let's go back to the roots. What do you think are the reason why people go into drugs? Let's not use people now, since we are peculiar about the female gender, because it's common among the male gender. Why do female do drugs?
Well, there are a lot of risk factors that can push someone into drugs. That's why it's important that we begin to look at substance use disorder, which people call drug abuse, or addicted people that have substance use disorder. We need to begin to look at it as a health challenge instead of a criminal justice problem. Because in that word, substance use disorder is a chronic relapsing brain disorder, brain disease, that is characterized by a person going after a particular drug of choice, regardless of how it affects him, his family, and his immediate environment. And there are so many things that can put someone in that position, so many risk factors. For example, the person could grow up in a community where drugs are common as flowers on the table, where cannabis and other common drugs, the most common drugs abused in Nigeria are marijuana, tobacco, and alcohol, where alcohol is always on the table. Maybe in the family there's a bar, and anybody that just comes from work just goes there and just pour one drink and drink. You can't tell the person about anything that alcohol kills, because the person is seeing the disparity in the information you're giving them. He sees that maybe his dad has been drinking every day. Dad must drink 4 bottles of beer. Dad has never gone mad. The dad is able to meet his responsibilities. The person sees that the mother, maybe when I was in school, there was a young boy that spoke to me. The young boy, we had seen the boy taking this syrup, Benelin with codeine syrup, and when we asked the boy said that his mother takes it every night, 2 bottles every night to sleep. And people say, no, it will make you mad. He say it can't make, his mother is not mad. And you have to see that so many things can push someone. There was a study, apart from peer pressure, apart from availability within the neighborhood, apart from this thing, family members using drugs. I have spoken about it before. There was a course we took in Harvard Medical School, Neurology of Addiction. It speaks about if the professors proposed that if someone had done drugs, like a family member had done drugs, because it's a chronic relapsing brain disorder, it to damage a part of the brain, and those traits are transferable from generation to generation in such a manner that if someone that came from that family was ever to come in contact with that particular drug, the drug would taste different to the person, because his grandfather had used it, his father had used it, and now he's tasting it. It will be different from the way that none of the family members had ever used it. One of the examples they used was alcoholics. They used people that they said that their father was a chain smoker, the grandfather is a chain smoker, they started smoking now. So some of those traits are transferable. So now, when someone has already been, let me say, biologically disadvantaged, and put in that type of situation that is susceptible to becoming addicted to a particular drug, and that person now happens to come in contact with that drug and now becomes addicted, do we now treat the person like a criminal, or treat the person that has a health challenge and should be treated? That's now the question. Why do we stigmatize?
Okay, now you there was an article that I read, I think you sent it to me, that says that most women that use drugs are more likely or prone to gender-based violence. How can we clarify that?
It's a study. It says that 2 to 5 times more likely to have gender-based violence, especially intimate partner violence. Yes, it's a clear study that sometimes women that use drugs or in relationships that their partner uses drugs, they are more prone to engage in. I think to look at it from apart from the statistics, just look at it at the base point of view. Maybe that the relationship, maybe responsibilities are not being met, and the person is choosing to lash out in that manner. That could be the way. There's another study that shows that most women will carry a man's drug use, will cope with a man's drug use, and if it was the other way around, the woman was using drugs, the man is more likely to push the woman out. When we look at the drug challenge that we have in this country, even the world drug challenge, women are, I must say, a bit disadvantaged, because when we treat women that have substance use disorder, women have unique needs, and the current research in the world drug challenge has not really taken into much cognizance the unique needs of women. It was more of the research was done looking at men. When we look at this, there are also different challenges when it comes to law and order. When it comes to, most women will always be given the low level areas in crime organizations, and most women are more likely to go to jail for a man's drug crime, because women are usually given low level positions in gangs to transfer the drugs, to harbor the drugs and travel. So in prisons you'll find out that a lot of women are facing time for a man's drug crime. So
okay, talking about the team, you said treating people with respect, people who are doing these drugs. Now, are they specialized people? Are they specialized places? Who are there to treat these people?
Teaching people with respect, there are people that are trained on how to handle substance use disorder, but that's why I was saying this time I want to put people first. We want to do a sensitization to bring the general public to the knowledge to understand that it's not only left for those rehab, the nurses, this thing, to be the one to treat them. That you too, you have to take into cognizance their unique needs and begin to look at them, that these ones need help, that these are not criminals. That's why we're looking at the way that the new government under His Excellency Bola Ahmed Tinubu can look at policies that can better help these drug users. I believe that His Excellency made a promise to include youth in his new government, and if he really has a plan for the youth, of which he has, I believe that he's going to begin to consider what are the major challenges that the youth face, which is actually drug usage. Because of the employment, a lot of people turn to drugs as a coping mechanism for the things that are going on. So I believe that the appointments that have been made, the essay on health, Madam Salma Kolo, I believe the special advisor on policy, Haja Bala Usman, the former MP boss, they can begin to look for people that have knowledge, people that have cognizance, that have been working in this type of field, and begin to research, begin to talk to them, begin to engage them to prefer better solutions. Because there are a lot of things that we can do. We can strengthen prevention, we can have school-based education. The UNODC has developed fantastic programs with international efficacy that's cut across different demographics to handle this challenge. In the secondary schools, we have drug education. I was trained in drug education. We're trained in UYO, a couple of other civil society organizations and leaders that work in the prevention sphere. We're trained on that for like a couple of days. And there are other programs. There's the Strengthening Families programs. We have a partner that's implementing that in Borno. We're in Borno in February, Strengthening Families program. There's DPTC, a general sensitization program. There's Live Yulu. There are different programs. I think Yulu was being implemented during Buhari's tenure by the under at-risk children's program. So there are a lot of programs. I believe that this new government can get capable people and recognize these unique challenges and begin to tackle it, because there was an estimate that was given that there's going to be a rise in drug use in Africa because we have a young population by 26 to 40%. So if we don't, it's like sitting on a time bomb. If we don't do something, there's going to be a rise. So we must begin to curtail these challenges at different areas. Those in prevention, those in sensitization, those talking to the legislator. Of course, we consult with the committees, the Joint Committee on Drugs and Narcotics in National Assembly. But other actors can reach out to their legislators, can reach out to their leaders, their senators, their honorable members, and tell them, can we do a program on drug abuse in the community? That's what we have been doing personally, reaching out to members also. Or we can do that, but we just need to change the mindset, and everybody has to put their hand on deck.
Okay, now let's look at this. You mentioned the fact that so many women, there are some women that engage in trafficking. How frequent do you see women that actually engage in this drug trafficking?
I will not make it seem, because of the data, I will not make it seem as if it is like a large percentage, but there's a study that shows that women from families where somebody used drugs and is a gang member are more likely to be trafficked. It was a 2014 UN Women study that said that the women that come from families where family members have been involved in drugs or involved in gangs are more likely to be trafficked. Also, it's not a proven study, because there was a study that was done. They looked at the percentage of people that was a law enforcement study, looked at the percentage of people that were caught, armed robbers, sex workers, I think burglar. They were about some parameters. Captured in parameters was armed robbers and sex workers, and the percentage was not high to say that every lady that does drugs is a prostitute. It was not. The study didn't give that impression. So some people that are involved in crime, they are very intentional and they're very smart. They plan. Sometimes they don't want any drug messing. They don't use drugs to perpetrate crimes. People that want to use drugs usually use it on their own. Not saying that sometimes criminals don't use drugs, but people that want to use drugs probably use it on their own. It's not every time that they are criminals.
Okay, now speaking from the field perspective, how do you think these drugs affect the female gender at large?
Okay, there's a study that shows that let's look at the most commonly and easily accessible drug. Let's look at alcohol. The study shows that although men drink more than women, 50 to 100% of alcohol-related deaths are more attributed to women. Or let me just say 50 to 100%. Women are more likely to die from alcohol than men. And that now goes into foundation of the biology of men and women. Men's body have more liquid than women. So if a man and a woman were to sit down and say they're going to have a drinking competition, it will not be a fair competition, because as the man is taking the alcohol, the water in his body is diluting it. Meanwhile, the woman has less liquid in her body, less water in her body, so she's getting intoxicated faster than the man. So if they're able ever to sit down, it will be an unfair competition. Women, there's a study also goes to show that women abuse more sedatives, and a lot of distinct drug related deaths in women have been attributed to sedatives. Another study shows that women are most likely to engage in high risk behavior, especially sexual high risk behavior, than men under the influence of drugs. So that could expand to HIV, AIDS, and other diseases, impregnation, and all those other things that are associated with it, to be raped, and all those other things. So in terms of drug usage, women are a lot more at a disadvantage, especially that study that says that women that inject drugs are more likely to use drugs with multiple partners.
Yeah.
Yes. So women, we have to begin to look at a way to address the unique needs of women.
But some people say that even if you compare a man and a woman using drugs, that a woman will still manage the home better than a man.
Yes, that's sure.
Why is it so?
It's not that. Why is it so? It's what we're seeing. It's just what we're seeing.
Okay.
Like, you can see a woman would have. Women are unique. Women are dynamic. A woman can have. That's why I feel like we need to look into women's challenges, because a woman can have her family, can have her work. She'll wake up in the morning, take care of everybody, get everybody out of the house, go to work, come back earlier, get everybody ready for dinner, everything is in place. And in the evening, she's just relaxing, doing her drugs. And the children are watching like, Mommy, what are you doing? She's saying, I just want to use it to sleep. That's what actually happened to my friend, a friend that I had in high school. When we caught him with codeine, he said, his mom uses it to sleep every night. And when people would come to talk to us about that codeine kills or cannabis kills or these things, you begin to see the disparity. This is a woman that meets all his needs, all the responsibility, and you're telling him that the mother is irresponsible. Meanwhile, she's paying the school fees, doing this, doing that she has never gone mad. That's why we need to begin to address these issues so that we can curtail it. He later went into drugs because of that example, that precedent that had been set. That's why I believe that this new administration of His Excellency Bola Ahmed Tinubu has that work cut out for them in terms of policy. I believe that Haji Abala Usman is going to be working proactively to review a couple of policies. What are the policies for drug abuse in schools? There was a program we did, drug abuse in the school environment. Another one we did in secondary schools, Be Smart, Don't Start. And in the course of that program, the team was to equip secondary schools with the knowledge and materials to curtail the use of drugs. Now, in the course of those programs, we train the teachers how to identify, how to address those issues, and we also give the schools drug policies. So those policies show different ways to address drugs in the school. If a cleaner is caught with drug, they know how to address it. If a student is caught with it, they know how to address it. What are these things? Do they seize? Do they this? Everything is captured in it. But does Nigeria enforce a general drug policy for secondary schools? Or is it just anybody that they catch with drug? Expulsion. To where? To where?
That's a reality.
To where? Throw him out to the streets. To where? So we need to begin to look at all these things. What is the plan? We need to begin to look at the health. What are the plans? Is there a plan for, there's a training with international efficacy that the UNODC does called TRICNET for healthcare workers, teaching them how to address the unique challenges of drug users. There are trainings, we can train the judiciary so that if someone is angry and he comes into court and maybe someone had been influencing his son to do drugs and he comes into court and they say that they caught one young boy with drugs, are they going to give that young boy 25 years, which is the maximum sentence? Or are we going to start to look to alternatives to incarceration? We need to begin to explore these policies. Can we have a policy about drug users, alternative to incarceration? Can you give somebody 1,000 hours community service instead of sending him to prison to become a criminal, to have scars, to come out more angry, to do more harm? We need to begin to look at other policies, things that we can use so that we can mitigate the use of drug in our society.
Okay, you really emphasized on policies, solutions. Now, what are the preventive measures? Like, how can we prevent it from happening in the first place?
I believe that we have programs in secondary schools, and those programs in secondary schools are already subjects in secondary schools. They already capture a bit of drug abuse education. Can we strengthen those programs? Can we turn it instead from being captured inside subjects, can we now turn it into a program sitting that they will say that each secondary school must have this type of club? As they have this type of club, the secondary school must be able to carry out these things. Some of the programs that we did were 1 year. Some of the programs, the schools extended it to 2 years. We would have classes, we would have lectures. We train the teachers to be able to be the ones to carry out these programs in the schools. So is there a way that we can create a school drug education program that will be running in every school in Nigeria so that we know that this issue is being addressed? Some people think it's only when you get to secondary school, you get to university. I will tell you that I've been in primary schools where people were caught with drugs. There was a primary school that I went to, I won't say the name for obvious reasons, and they were telling me how they had intercepted a young man with this type of pick milk can, but it had a lid. The pick milk can was full of cocaine. In primary school. And the guy had gathered some young boys around.
Not even Benedict.
cocaine. He said that if he was telling them that if you take it to make you strong, any teacher that talked to you, slap the teacher.
Can you imagine?
So they are trying to see what this thing was. When one teacher intercepted them, saw this thing, started interrogating. The boy said that his daddy takes it. I took it from his daddy. You can't. Yeah. So what is the school going to do? Expel him, Abi?
Yeah.
to go to another school and continue his. So we need to begin to look and address these issues. What are the ways? What are the ways? What are the ways? There are a lot of countries that have taken and done a lot of measures. We can take a playbook from them. The UNODC has a playbook full of programs with international efficacy. All we just need is implementation.
Okay, now when we hear that, personal experience with some people that actually do things like weed and cocaine. No, not cocaine, weed, marijuana. And they say things like, whenever I take it, I'm more active, I'm more productive. That is in their own defense. Before, what we always hear, I don't even listen to people that say that again, is that weed is medicinal, so there's no problem with it. But when you interact with some people, they tell you things like that, and they use it to bring in, just like winning more souls to whatever they are doing, to bring in more people to what they are doing. So how can we change the narrative about it?
Well,
because sometimes, personally, I've seen that, I know a lazy person, that if the person gets high, the person can be more productive. The person has energy and does things. when we're in university, the person will read, we get to exam and you pass and stuff, and you're trying to tell this person it's not good, but then the person is telling you more good that is doing to him than harm. So, and is now trying to convince other people to join him or her in doing that same thing. So how do we change this narrative?
Well, it's obvious that that person has a substance use disorder problem. So the person has begun to join activities to his drug use, and that's like one of the last stage. I hope the person has not broken down by now, because sometimes people just start using a drug casually. The next thing, the people start using it more often, and they just say, firstly, experimentation, next, casual. Then another stage comes when the person begins to join activities with that particular drug usage. How do I do it? If the person ever wants to go for a party, he must take that drug. If not, he cannot be in that party. If the person ever wants to do this, he must take that drug. If not, he cannot do that.
Can't function without the drug.
He can't function without the drug. So that those people that you saw were in another high level of substance use disorder, in which that the natural activities will not go on except the drug is involved. Usually when there's an evaluation of people, when we do an evaluation of people under substance use disorder, would have things like, how often do you take drugs? Like a questionnaire, 13 questions. How often do you take? Has question like, how often do you take the drug? How much do you spend on the drug? Do you take it 1 week? Do you take it once a week, once a month, twice a week, 3 times a day? How often do you take the drug? Does your drug use affect your work? Without the drug use, are you able to carry out activities normally? If you don't take the drug, do you have mood swings? Are you angry? Are you this thing? Does your drug use affect your relationship with your family? Does your drug use cut a large amount into your income? Does your drug use make you to have challenges with law enforcement? So among these questions, among the 13 of them, anything above 2, someone that has a drug use problem. Anything above 5, 6, the person has a serious drug use problem, and that person should be treated immediately. Anything below 2, well, the person doesn't have a challenge. But anything above 2, the person has a challenge. He can be an outpatient. We can have outpatient program for him or inpatient program. But anything above 5, 6, that person needs to be treated immediately. So that's one of the behaviors of someone that has substance use challenge. The person might be very lazy when the person takes a drug, because the person has begun to merge some activities with the person's drug use. The person cannot be social except the person has taken the drug. So if the person has not taken the drug, he'll be gloomy all day. So you'll be saying the person is lazy. Okay, it's not the drug that is making him. No, it's not the drug that is making him. The person has a substance use disorder.
Well, practically, one of my friends said the drugs, I don't know, he takes a particular one, I don't know. He said the drugs brings out the best in him. He's in this field, and he presents very well, like he's good in it, but then he still insists that anytime I take these drugs, I do wonderfully well. And again, he said something that if you are not good, like if you've not read or if you are not prepared for whatever you are going to do, and you take the drugs depending on it, that it will help you, it doesn't work that way. But as far as you are prepared and you now take the drugs, it brings out every best in you. How true is that?
Well, you can see that he has become dependent on the drugs.
But then even without the drugs,
he's
yes,
still
he
good.
still performs well.
So, and we understand that these drugs damage a particular part of the body. Yeah, the drugs, you are abusing a drug, taking it not the way I meant. So it's damaging parts of your brain, different parts of your body, and you are setting a precedent for your unborn children, and you are cutting your lifespan short. I believe that although he's having fun at the moment, later he might have to pay the price for his indulging in such. So if you are watching me now, I would like to let you know that it might be fun today, but when the challenges come knocking, you have to pay the price. Exactly. So why will you put yourself through that? Why will you be the one to set a trend of drug abuse in your family and pass those trends from generation to generation? Alcoholic pass it down, chain smokers pass it down. Don't be the one to put your children and make them susceptible to such drugs.
Okay, for a woman that finds herself in this particular position of drug abuse, what's the best way for her to find help?
The NDLA has a toll-free line. It's usually displayed on some channels. Reach out, start talking to someone. Just don't keep it to yourself. Look at your community, and there's a list. If you search online the drug help net, you see a list of some different organizations arranged according to geopolitical zones. It was created during the COVID. Some of them give free counseling services. Some of them can give referral services, or you can reach out to us in Youth International.
And they'll do it without discriminating them.
They'll do it without discriminating, especially those drug help nets, those numbers online. If you just Google drug help nets, you see a lot of numbers. You see a lot of organizations. You see a PDF characterized by geopolitical zone, and you can call numbers there depending where you are to access help. And they won't discriminate. Most of those ones have been trained by the United Nations Office on Drugs and Crime. Okay. You can reach out to us.
Okay, now let's look at drug supply control. In that aspect, how far have we gone in the battle? Like in fighting it? Because I know that, I think NDLE is part of it, right? And I know that every time I see the PRO, Femi Babafemi, he's always putting out things, we'll cut this person with this amount of drugs and stuff. But then we are still seeing them in the corners of our streets, looking around and carrying out this drug abuse. So how far have we fought this battle, and how far have we won?
Well, first of all, I was opportune to hear the former EFCC chairman say that when you fight corruption, it fights back. I've been opportune to hear our chairman, current chairman, chief executive of the NDLA, Buba Amara, say that when you fight drugs too, that it actually fights back. So I believe that the NDLA has been proactive in delivering its mandate on supply reduction, in curtailing the activities of the barons, the dealers. We have had some of the most high-profile busts in ages. In the last 10 years, in the last 3 years, we have had some of the most prolific crackdowns on drug users, barons, people that seemed untouchable, that have been touched, that have been pinched. So I believe that the NDLA is doing a lot on that part. The police, I've seen instances, so many instances, they're doing a lot, but I believe the government can increase that funding, because everything is subject to funding. If the government can increase that funding, increase their incentives. The NDLA had requested in their new bill, the amendment of the NDLA Act, there are a lot of things that they are requested. I'm sure that the more that their unique needs are met, the more inspiration, the more motivations the officers will have to go even beyond the call of duty to make sure that the mandate for a drug-free Nigeria is met.
Okay. Now, in a situation where we have to wait for government policies, for government to implement and all that, what should individual do? What should family do? What should society do before government comes?
I love this question. We have a lot to do. It actually starts with us. in the intervention value chain, there are a lot of stakeholders in the intervention value chain. A lot of stakeholders. We have those in prevention, talking to the schools, primary schools, secondary schools, doing outreach, creating innovative programs, engaging the teachers, engaging the different students, keeping them occupied. Go to sensitization, people that will go to communities, go to IDP camps, go to those type of communities to drive this message deep within them. Also, we have those in advocacy. We work with the House of Reps Committee on Narcotic Drugs. We work with the Senate Committee on Narcotic Drugs. I'm waiting for our new chairman or chair lady to come into office. So we work with them on both places. We're waiting to see who will be there so that we can begin to advise and recommend on how they can use scarce government resources to implement programs that to drastically reduce the challenge of drug abuse. We have those also that are into rehabilitation. They have the facilities and we work with them to make sure that people get the right services that they need, to make sure that they understand the unique challenges, to make sure that they offer the unique solutions to especially women challenges and other people. We have those that have community-based centers, NGOs that offer, CBOs that offer those type of services. We have those that are policymakers in the Ministry of Health. We have those in the presidency, in the executive, that can begin to reason plans and reason the way that they can develop these policies. I've said that His Excellency, our new president, Bola Ahmed Tinubu, has things to do on that part. Then we have individuals like yourself and I that have heard this information about about drug use, that it's not a criminal justice challenge, that's a public health challenge. That means that these people are victims. That means that these people actually need help. That means that if we stop discriminating these people, they might actually come out of that shell and say, I know what I'm doing is bad, I need help. Then we can begin to help them. We can begin to look at the cost of rehabilitation in Nigeria is between 300,000 to about 3 million naira.
For drug abuse?
A month.
A month.
A month.
Oh wow.
I was talking to someone from Hot FM, and she said that she had recommended somebody to my friend's center in Galadima, and the person that she was happy the family was able to pay that amount. I won't say the particular amount, but we're available for referral services to get that person treated. And also in terms of sensitization, you can reach out to your legislator. There are so many programs that have been put in place. You can talk to him that, see, sir, I know that Uncle Romeri is becoming a challenge in Imo State. What can we do? We can sensitize this youth. I know this NGO. Let's call Kenneth. Let's do this. Let's work on something. You can reach out to your senator, say, sir, in Jos, all they want to do is, because of the weather, all the boys want to do is smoke weed and drink alcohol. Can we start a program to teach people on lifestyle, on basic skills, emotional intelligence, lifestyle skills, so that they can take away those things and begin to replace it with emotional intelligence, different types of skills? Can we do an empowerment program? Can we do a sensitization program? Companies, everybody has someone in their family that they can talk to that can do CSR. You can reach out to family members. Can we do a program, intentional program in our village, in our city, in here, in our backyard? We always see boys smoking there. Can we do a neighborhood program? Neighborhood program. Let's gather send a circular to everybody in the neighborhood to say we're going to do this. Let's bring 3 people that are professionals on substance abuse to come and talk to everybody in the neighborhood. And they gather all the parents, teach them how to watch if their children are doing drugs, teach the youth about the dangers of drug abuse, teach them about other things that they can use to. And before you know it, we're breaking the dream. You know that a target has been said that Africa between 26 to 40% increase because of our youthful population in drug abuse, in substance abuse. So that target has been set, that this is what it's going to be. It's going to rise like this. So it's our responsibility, collective responsibility. You can't say only to the pastors, they should change their message in church and begin to look at these things. The imams, they should do this and begin to look at these things. That we should wait for the government. His Excellency is busy forming his cabinet. Meanwhile, what are we doing? I believe that the road to a drug-free future starts with us. and we must take it one step at a time, holding hands together.
Yeah, definitely. Thank you so much for your time with us.
Really
An interesting
insightful
session with you.
Pleasure.
Okay, viewers, I think you've heard it from our guest today. It's a collective effort. Be your brother's keeper. Look at your neighborhood. Try and help out. Look for, like, as you just mentioned, in your village, things are happening. You're coming from the city to the village, they give you some respect. Instead of just going there to share chicken and rice, do a community outreach. Reach out to them. Know the challenges that they're going through. It will, like, okay, just going back to this, there was an extended family member of mine. What happened to him? He died, I think it was of kidney problem, and it was from this drug abuse. He started mixing some drinks. See all those I don't want to mention the brand of the tea, all these teas with urumiri and stuff like that, and that was his daily water. And at the end of the day, he had kidney problem and he died at 26 or so.
Wow.
And they couldn't do anything about it. So every time we go back to the village, I see him, I greet him, we play and stuff like that, but I didn't know he was into that kind of thing. You get, if we were aware, maybe we would have spoken up. I mean, he might have listened, but we didn't know he would just go out and hang out, and that was how he died. His life was cut short at 25 or 26. Be your brother's keeper, please. Drug abuse is not for us. Quit saying whenever I'm high I'm more productive. Whenever I'm high I like the cruise. So people say it makes me forget my problem. When you are done, it's for a few time. It will come back again. Your program is still waiting for you to come and solve the problem. That was all we can take on today's episode of Engendered. Do well to join us next time for an interesting episode. I remain Chidinma Ufomadu.
I am Pamela Ajaero. Thanks for staying with us. Bye.